How obstructive sleep apnea cause or aggravate diabetes. Sleep apnea affecting blood sugar levels. Sleep loss reduces insulin release, raising blood sugar. Sleep apnea affects type 1 and 2 diabetes. Only type 2 diabetes may result from sleep deprivation. Even with diet and exercise, someone who loses sleep nightly may have high blood sugar at the doctor. Sleep is as vital as nutrition and exercise for health. Hypoxemia. Sleep fragmentation and hypoxemia, or episodes when the blood's oxygen content falls below normal, are the two primary effects of sleep apnea throughout the night. Hypoxemia can set off a chain reaction in the body that leads to impaired glucose tolerance and increased oxidative stress, which means the body has an excess amount of molecules called reactive oxygen species. These molecules can disrupt the body's ability to repair itself. The whole process can also contribute to insulin resistance. Sleep fragmentation. Sleep fragmentation of any sort can push a person's body into a state of stress and cause the release of cortisol, a hormone that can strongly alter the metabolism. Repeated awakenings can also lead to insulin resistance, a greater appetite and the craving for carbohydrates. Diabetes gets its foot in the door with all these changes. Higher sleep variability has even been linked to problems with controlling the amount of glucose in the blood. The more severe the apnea, the more disturbed a patient's glucose control. Sympathetic hyperactivity and parasympathetic withdrawal. The sympathetic hyperactivity and parasympathetic withdrawal associated with OSA are likely mediators of its adverse effects on glucose tolerance. The ability of OSA to activate the sympathetic nervous system is well characterized. Since activating the sympathetic nervous system can also potentially impact insulin sensitivity, it has been proposed that increased sympathetic nerve activity may lead to insulin resistance in OSA patients. Hypoxic stress. Hypoxic stress caused by obstructive sleep apnea, OSA, induces activation of the hypothalamic pituitary adrenal (HPA) axis, which in turn raises cortisol levels and may be a contributor to insulin resistance. Obesity. In many cases, obstructive sleep apnea, OSA, and obesity coexist, and obesity is a significant risk factor for both OSA and diabetes. Insulin resistance and diabetes are two conditions that may be made more likely by having excess body fat, particularly in the abdominal region.